Hey everybody, it's Kevin and Zane from RPH Ally for another episode of the Healthcare Tech Show. Exciting announcements this week, which I heard about a little while back, and Zane told me, "Hey Kevin, you got to keep this hush hush. Don't be blasting it on social media." So I obeyed. But to kind of get into it, at first we did title this one EMR, LIS, and PMS. Oh my! So many issues, Zane. You and I have had long conversations, buddy, about like all of our frustrations, the difficulties within these individual systems. And I know for you that was kind of a genesis story of really getting you motivated to do something about it. Can you tell us more, buddy?
Yeah, I mean, so for me, technology has always been something that's meant to be helpful. So it's always helped me in my life. It's never been a barrier. I shouldn't say never, but it's rarely ever been a barrier. But I feel like in healthcare, it's always, not always, but it's a lot of times viewed as a barrier and also is an actual barrier, such as EMRs and such. Just the way they were built were not, it's not conducive to an electronic workflow. They were built to mimic paper workflows. So I actually, my actual startup way back in the day was actually trying to build a cloud-based EMR. Unfortunately, we didn't work. It didn't work out, but that was kind of what led me into tech and healthcare, and being somebody who can do both. And that was, to me, that was an amazing place to be, because I feel like we need more clinicians in the tech space to guide the future of healthcare. Right now, the future of healthcare is being guided by other people that do not practice medicine. So
Yeah, I think that's a lot of fantastic points there. I mean, just kind of laying the foundation of, like the stuff we're doing in the pitch competition. The pitch competition, if you haven't heard about it, we'll put the link inside of this in the show notes, and Zane is posting about it on LinkedIn and Digital Thoughts. But it's kind of the whole impetus there too. I mean, the frustrations with the EMRs, the laboratory information systems, the pharmacy management systems, those things, like, to make real change that's impactful on a base level, it's going to take someone who actually knows what they're doing on the base level to make those changes happen. So, saying all of that, I'm really proud to say that my brother over here, he was able to make the pivot. I mean, let's be honest, like, the work that's being done behind the scenes in the clinical trenches is essential, and it's fantastic, and there is no taking away from that. There's not glory jobs and non-glory jobs. Like, the things that are being done inside the hospital systems, retail systems, they're amazing patient care. Like, that's how we really deliver true care. So I'm not limiting that. But Zane's passion has really been in, how do I approach it from a technology standpoint? And he has some really exciting news, and he's going to give you guys some awesome tips on, if you're looking for a transition or pivot, maybe how you could do it too.
yeah, no, thank you. So it's been a couple of weeks now, but I accepted a job to be the product manager for AmerisourceBergen, to head their provider analytics team, a lot of products. So it'll be focused on urology and oncology. So I'll still get to use my, almost 10 years of oncology experience, which I was really excited about. And this was and the team is amazing. It's one of the few places when I interviewed, they really valued my clinical skills, and they were looking for somebody with a clinical background.
Wow.
So one of the things that I learned is, you really only need to see one person to say yes, and one person to see what's inside of you. But that can take some time. I mean, this journey has been going on for almost 4 years. At first it was kind of embarrassing to say that it took me this long, but I think that it's important to highlight that, if you really want something, you really have to be patient and persistent at the same time. There were many times where I just wanted to give up. Every couple months, every 10th or 15th job application, I just was like, I'm done. I can't do this anymore. But, like, some things that, when I started getting traction, was mainly when I started focusing in on what I actually wanted. And product management has been a job that I've always really liked. I didn't know it was called product management when I was doing my startup, but later on, as I was networking with people, and I found out that, okay, what I really want to do is product management. And then in the last maybe year to 8 months is when I really started focusing in, and networking with product managers. And one of the things that you'll find is there's a lot of people that are willing to help you. And so I found a great group of, actually, pharmacists that were product managers, that helped me a lot. Literally rewrote my resume, ran through interview prep with me. Also, most importantly, told me that I could do it. And I think that that's one thing that's really powerful, is finding people that will champion you, not necessarily in the companies they work for, but just you as an individual. And it's really easy to just get lost in the despair of the job hunt.
Mhm.
But it's really nice to have people that are physically doing the job that you want, looking at you and just saying, you can do this. You have no problem. We just need to tweak a couple of things here and there, the way you answer some questions, the jargon you use, and you'll be in there. And I'm living proof that that's really all it took. And, you know, and there's a lot of, and then, the other thing that I had to realize was there's a lot of things in healthcare that we do that we just think that is our normal job that are extremely transferable skills to everything that we do, right? So we can handle stress, right? So there was a question, somebody asked me, how do you handle stress in stressful situations? And I'm sitting there having ran to like 3 codes the week before, without like thinking anything. How many times do we walk into ERs, or when a patient comes up to the counter, we have no idea who they are, what's going to happen, how the interaction is going to go. So we're very adaptable. We think on our feet really well. So I mean, I think these are things that we need to start highlighting it about ourselves, and not just say, oh, that's just the way it is, that's just our job.
I love it, buddy. I mean, I think that those are some great. I mean, even looking at some of the stuff that I'm doing, like with RPH Ally, like how are we evaluating people that we are adding to the team? In general, it it really has nothing to do with the resume, like the way that the resume kind of looks on surface level. It's really the depth of like who's recommending them, who's talking about them, who feels like they're valuable. Are they showing that they're really talking the talk and walking the walk with what they're doing? And I think that you really leaned into it with trying to find folks that you have close relationships with, that you could develop a rapport with, that you could connect dots with, and they could see like your mind, the way you think about things, the way you want to see things changed, and that it wasn't purely theoretical or academic. That it was very applicable. Ways about making transferable change. And the other piece that I do love, I mean, I think that any PM job, which the PM managers that I know are brilliant, and the ways that they transfer their skills, I think is fantastic when it is a clinical PM. Like that's impressive. But when you told me it was a PM job, I thought, oh man, he's going to go over to the dark side until you told me it was related to your clinical skills you already possess. And I think that's even more powerful. And kudos to AmerisourceBergen for recognizing the need for a champion within their team that had that kind of skill base behind them. So tell us this, Zane, like interviewing process, everything throughout there. Did you feel like you had to go far and beyond your skills that you had as an oncology pharmacist, or did you feel like you really had most of it down? Like what do you feel like pushed you over the edge and helped you with landing this position?
I think that so obviously my clinical skills and all that experience helped a lot, but I also during this time I was also consulting with companies. Kevin knows better than others. I was helping out a bunch of health tech startups, and that was the reason for that was because you know, to prove to not just to prove to myself, but to prove to others that I can do the job. And it was just a mutually beneficial way, reaching out to startups that don't have the capital. I was willing to work for free, honestly, for most of it. And so I got to kind of do some PM responsibilities, put stuff on my resume, and then they also got my brain. And whenever they needed me, they were able to tap into that. So that's another thing I would say to people is it's really easy for me to say because I'm in a very privileged position and I was able to work on the side for free. But if you can, reach out to people that you think are doing cool things and see how you can help them. Don't just
Yeah.
be like, oh, let me help you, but like, try to bring value to them in some way, shape, or form. Like my value was I'm in the oncology space and I worked in all these areas in oncology. I understand the healthcare system. So it's all about the story that you craft and what value you're bringing to them. And you'll be surprised. You'll not, I mean, there's so many people that'll just say yes. They're just looking for help. So yeah, that's kind of what I did. And I think that's kind of what pushed me over the edge was not only did I have the clinical skills, but I also had experience as a PM, not like it wasn't my normal job, but I was doing it on the side and I was able to talk to the role and what it requires. And, honestly, jargon matters quite a bit too. So I learned jargon,
Hmm.
jargon along the way, also with the help of others that were in the role, talking to them and them prepping me for stuff. So those are all important things that I think get overlooked quite often.
Oh, nice. Yeah. I mean, it's funny you say the jargon because we always hear in healthcare like we use too much jargon. we're a very jargon heavy community, which we are, especially when it comes to patient to care provider kind of interactions. But when it comes to the technical side of things, you're right. I mean, there's a separate set of language, that is utilized on that side to make sure that you can do the translation between dev team, clinical team, and pull everything together, on an appropriate board. So with like technology and things that you were trying to get yourself familiar with, Zane, beforehand, like what are some of the things that you were looking at? I mean, like task boards, scrum boards, like Notion, any of the like pieces of tech that you're like, if you're trying to go into these roles, or even if you're trying to pull these kinds of like product management thinking into what you're doing clinically, these were beneficial things for you to kind of look into.
I mean, for me, like I didn't have like the traditional product management roles. It was me, my startup, which I was basically no one told me what to do. I was just doing it.
Yep.
And then like working with these other startups. But I knew like I knew like road mapping and how to strategize. And also the things that I really enjoyed was strategy, like strategic thinking, all that stuff. I didn't really have a formal like, okay, I mean, I knew generally what agile the sprint methodology is, but I would
Yep.
never went through a quote unquote sprint. So I mean, I was familiar with it. So I think it's good to familiarize yourself with different frameworks that exist in the job that you're applying to. You might not have
Hmm.
to like have done it, but it's good to for you to know, because if they ask you, like they did ask me, like, "Hey, have you ever worked in a sprint environment?" And I said no, but I said I was familiar with it, and I just kind of dropped like keywords and phrases and kind of described the process to them, so they're like, okay, this guy hasn't worked in it, but he
He
obviously
knows it.
understands what that is. And then they also, I was also asked like, can you make technical documents and this and that, which, and then you have to kind of think back at, okay, I haven't made a physical technical document as a PM, but I've done things where I was doing projects like analytics projects where I had to tell exactly what rows and columns I needed pulled from like Epic and all the other databases. And when I told them that, they're like, yep, that's literally what we need. So it's all about taking what you've done and presenting it in a way where they can understand it, if that makes sense.
Oh, it does. And I think it really ties into what we titled the episode, right? I mean, knowing what you know about a electronic medical record, a laboratory information system, a pharmacy management system, the intricacies and the back end components of those for reporting, for functionality, for ease of use, for data analytics, those really apply quite well to the jobs that we're talking about. In fact, you may have a more in-depth understanding of the logic that's applied than you even know, because you have to do certain things at certain times for the function, to work right, and there isn't steps around the process that's already in place. And now you can understand why some sprints take longer than others, because guess what? If you can just enter something into a pre-filled or canned text or a drop-down menu, and now you can make some subtle adjustments, easy. Like that's back end stuff that we're doing all the time inside of those systems. Then now you can understand to a certain degree how you can apply that inside of the product management type of role. So I love it, Zane. Any we're I always knew you and I would run through these like fire. It's 13 minutes on us. You want to plug some stuff, buddy, for our pitch competition so people know about that and some of the things that maybe like what we're kind of trying to bring to the table to help them out with during this early stage or juncture.
Yeah, so I mentioned that I had a startup, and I just wanted to build something like a community where it was clinic. We want to build like innovation in the healthcare world and led by healthcare people. So we're trying to get a pitch. We're getting a pitch competition together. The link to the form will be below. The only requirements we have is that you have to have a founder that has a healthcare background, is in healthcare in some way, shape, or form, and also we just need a pitch deck so we can evaluate your startup. That's really it. We're not looking for specific things or anything. And then the goal of this is to connect us to each other, and then also solicit feedback as well from people that are in healthcare and other areas as well. And then hopefully, build connections and bridges, and hopefully maybe you'll find some mentors that can help you along the way.
I love it. Yeah, I mean, I think not everybody has just a product manager or somebody that's in legal, someone that's in operations just in their back pocket to really understand those things. And so at least if, at the very least, if Zane and I can make some connections for you so some people in that world that can familiarize with those things as you're growing as a business leader and developing, then absolutely fantastic. Zane and I already kind of have a list of individuals that are really excited. I mean, honestly, like I think the folks that are listening would be surprised if you are thinking about entering in and you've got a startup idea. The kind of individuals that are thinking, I love this. I want to talk to more healthcare providers and be able to help them, be successful. I've already been impressed by it. Like Zane and I've had separate conversations with some of these individuals, but we're looking forward to it. If you want to learn more and you want to see more of what Zane is doing in Digital Thoughts, he has his own blog and his own podcast. He's got an RPH Ally channel on technology. And so check all those out. Join RPH Ally at rphally.com, and we can continue the conversation there. Zane, any parting words, buddy?
No, no. I just want to say thank you to everyone. I did not get here all by myself. I don't want to make it seem that way. I like to say that it usually takes a village, but for me, it took a whole world, and I am grateful for everyone that has helped me along the way. So thank you all, and yeah, reach out to me if you guys have any questions.
Awesome. Huge congrats, brother. Well, we look forward to seeing you guys next time. We'll see you next week.